Hello, viewers and listeners of SSBC. Welcome to your health program. So, your health programs is a program coming to you every Wednesday, and the programs is aimed to sensitize our community about their health issues. Today, I'm so glad to be joined by Dr. Joseph Mande, who is the eyes specialist and the director of the Buluk Eye Clinic in Juba. And today, we are going to talk more about the red eye disease. As you know that our citizens or our community now have been panic about the issue, about the pandemic, and the Ministry of Health also mentioned that there is an outbreak for that one. So today we are so glad to be joined by Dr. Mande. Please, you are most welcome to the program.
Thank you very much for hosting me.
Yeah. Dr. Mande, can you tell us briefly about the red eye disease that people have been talking about?
Okay, red eye disease, we call it conjunctivitis. It is a disease that affects all ages, and the causes for red eye are many, but one of them is a viral conjunctivitis. Red eye can be caused by bacteria, can be caused even by trauma, foreign body into your eyes, glaucoma, even trichiasis can cause red eye. But the epidemic, the one come in a huge number, is caused by virus infection, and the virus typically we call them adenoviruses.
Yeah, okay. Then if you look at Juba right now, people have that panic about the disease. So can you tell us the signs and symptoms of it, if someone's having that signs and symptoms, and what is needed from that person to do?
Thank you. The epidemic was declared last Monday by Honorable Minister of Health. It was first detected at the entrance at Nimule, and people are really panic. Yes. We start seeing it in Buluk Eye Center as per last Friday, and as of Monday it increased very huge number. And the symptoms and signs, mostly redness. That's why it's been named as red eye. Sometimes we call it pink eye. So redness, pain, tearing, photophobia, fearing of light. Sometimes even discharge can be mucous discharge because of a bacterial superinfection on top of the virus. And sometimes vision can be reduced because it causes cornea to be inflamed and the conjunctiva, so the vision reduced. Those are the most apparent symptoms. Sometimes even the eyelid will be swollen. Yeah.
Okay, then if you see it like, as you have mentioned, so is there any main cause that can cause this disease? Or?
Yes, as I said, in medical term we call it red eye syndrome, which means a lot of diseases can cause the sign or symptom, the red eye. So bacteria can cause that, even foreign body into your eyes or chemical fall into your eyes. These are causes of red eye, but as I said, virus is the contagious one and the one causing epidemic, huge number of cases in a short time. That's why now the most causes of the current red eyes in Juba is a viral conjunctivitis, which is adenovirus. Adenovirus, there are many serotypes, about 50, but the one that the researchers found is causing this epidemic is 3. Type 8 and type 19 and 37. Those are the 3 serotypes of adenovirus that cause this red eye syndrome or conjunctivitis.
Then for how long does the red eye last in a patient, for example, or a client?
Okay, red eye, once you contact the red eye, there is a period called incubation period, can be 2 to 7 days. You will not show any symptom or sign. But during this incubation period, you will be infectious. You will be spreading the disease. You will be spreading the infection. So after you show symptoms, some last for 1 week, but some can go even to 2 weeks. Yeah, based on also on your body immunity.
Okay.
Yeah.
So then when we look at if I have that one, so after treatment, for example, let us talk about the treatment of it. Is there any treatment for it? Or?
Yeah, viral conjunctivitis, there is no treatment for it per se. It is self-limiting disease. But we have remedies that can reduce these symptoms. Yes, for example, redness, we can give some medication called vasoconstrictors to reduce the redness, and we can give painkillers to reduce the inflammation and pain, and also we can give nowadays we are prescribing artificial tears because the surface of the eye will become dry, soreness. Then you give artificial tears at least to smoothen the eye or to wash out the irritants. And then there one antiviral that has been proved to be effective. We call it ganciclovir. And this is the one now we are giving to patients. It will not treat it, but it will reduce the duration of the symptom. If you're supposed to recover for 2 weeks, within 5 days you regain your healthy eyes within this short time. And then also we encourage patients to put warm cold compresses. You take a warm cold water in a towel and put just on your closed eye, at least to reduce this hotness or pain.
Of the pain.
Yes.
So okay. Then if someone, for instance, affected with this red eye disease, some of the people, they think that maybe it can lead them to a blindness. Is that true or something like that?
Okay. Viral infection, as I said, self-limiting. What can lead you to be blind when you self-medicate? There's some eye drops that is contraindicated. You cannot give to somebody with infection, like viral bacteria. If you give a certain eye drop with a steroid, we call them steroid, when you give to the patient or patient self-medicate, immediately the immunity that you have, the immune system in your eye will be suppressed. Then the virus or the bacteria will grow rapidly, even will invade the cornea, which is the main glass of the eye, the black part. It will become ulcer, and then eventually you lose your vision. But this viral conjunctivitis does not cause blindness unless you self-medicate, or sometimes some go to local doctors. Even sometimes they put some toxics into your eyes. So this is the one can lead to blindness, but it's alone, viral conjunctivitis will not cause blindness. And also there are some group of patients that if contracted this virus, it can be worse, especially those who have low immunity. Our patients in the wards, those with diabetes and those with the low immunity diseases, the sign and symptom will be worse, but still if they observe these public health measures and they apply the remedies that can reduce those inflammation, they will not go blind. So it does not cause blindness unless somebody self-medicate. Yes.
All right. Okay, viewers and listeners of SSBC, we'll still continue with our programs. Let's go for a short break, then we shall be back. A medical director of Buluk Eye Center, Dr. Joseph Mande Lawrence, allayed fear about the conjunctivitis or red eye disease causing blindness. He advised the general public not to panic in reactions to the outbreak of the pandemic in Juba City and Numule.
Today is the 4th day or 6th day we are seeing these patients. In a day we see around 150 to 100 epidemics cases of conjunctivitis. And this viral is very contagious. It spread very fast, and actually the symptoms and signs are very difficult to manage because of discomfort, redness, pain, and sometimes tearing, even sometimes seeing light, you see like photophobia. But the good thing, the viral conjunctivitis cannot cause you to be blind.
Dr. Mande says red eye disease is common among schools children. He encouraged teachers and parents to help the children in public health precautions, especially upholding personal hygiene, clean water, and in school.
It's self-limiting, but the duration of the symptom and sign can reach up to 2 weeks. We are able to manage the sign and symptoms, at least to reduce the duration to 5 days or 6 days. There is no exact treatment, but we are giving symptomatic management like artificial tears just to make your eye lubricated, and we give sometimes painkiller, and we have antiviral that can reduce the duration. How can we break the transmission of this viral infection? First of all, we want our people not to panic. You can just observe public health precaution. No shaking of hands, don't touch your eyes frequently, and even when you touch surfaces, you have to wash your hand or use sanitizer. And don't share linens or even handkerchief, even eye drop, don't share with people. Even the cosmetics for ladies, don't share cosmetics because it can transmit easily. Normally now in hospital we sanitize or we use detergent to clear, to clean the surfaces so that we can break the cycle of the transmission.
Student at Juba Diocese Model Secondary School and a victim of red eye disease, Carmen Benedictos, appealed to fellow students to adhere preventive measures for eye and health safety.
So actually the disease is a very dangerous disease, the eye infection disease. It got me 2 days back and I'm actually feeling bad about it because it is interrupting my studies, especially me, I'm in the final year, and right now I came to Buluk eye clinic and I took some medication, but I'm sure I'm going to be well.
Welcome back, viewers and listeners of SSBC to your health programs, and we are still continuing with our programs. Inside the studio with us, Dr. Joseph Mandel. He's an eye specialist, and we are talking about the red eye disease. You are most welcome once again, Doctor.
Thank you very much.
Yeah, Dr. Mandel, we have been talking about this issue of the red eye disease, that it may lead to a blindness, as you have mentioned, if someone didn't go with the proper protocols, for example. We have the communities from this platform. What can you say to them? We have some of the people, based on our economic crisis, they think of like, for me to meet the eye specialist, need money and what and all these things. The only thing I can do, I will just rush to the pharmacy, then to find for the drugs. And unfortunately, it may happen, maybe the person also is not a pharmacist, is not aware about some of all these things. What can you say to such kind of people?
Yes, to our general public, people of South Sudan, this red eye disease can be managed by health personnel, those who have the knowledge of the eye diseases. But no one's come to Buluk and turn off or go back or send back without being managed. Buluk Eye Center is a government hospital, and sometimes you will be asked to pay just a symbolic cost sharing, not like consultation fee in a private hospital. And for me to assure you, since this epidemic started, all the school children, we are seeing them free, and we give them free medication. And I will say again, don't rush to the drugstore or pharmacy to buy an eye drops of your own choice. There are hundreds of eye drops outside there. Then they're not specific, because eye drop is specific for specific for a special disease. So by buying or just getting your medication, okay, sometimes some drugstore, the sellers, they can be health personnel, but they're not familiar with eye diseases. Yeah, they believe that any eye drop can treat this red eye. So don't do that. We have branches, even Nimule now, we have very active eye center in Nimule. They're working tremendously since morning. They're seeing a lot of patients. When you go to Bor, we have also an eye center in Rumbek, in Torit, in Wow, in Bantu. So please don't self-medicate. Go to the nearest eye facility. You'll be managed accordingly, and your eyes will be safe.
Okay. Based on what you have mentioned, the outbreak started at Numule, because Numule's borders with Uganda, and based on the reports saying also we have like Tanzania, these things happening, there's too much and all these things. So how's the situation right now in Numule, and also how per a day in your clinic, how many patients are you receiving at this time?
Okay, this epidemic, we started hearing it since February. It started in Tanzania, it comes to Mombasa, then we had it a few weeks in Uganda. Then of last week now, that's why it enters South Sudan. Our clinic in Nimule, in the first day, they were able to see 383 patients. But to see in Buluk Eye Center, last Friday we saw like 78, but on Monday we saw almost 420 patients, and on Tuesday 300 something, and as per yesterday 345. Today it's almost like 320, and unfortunately majority of those are school children.
Yes.
School children. Ideally, if a child got this infection, he or she is supposed to be sent home, because he will continue on spreading the disease to the fellow classmate or schoolmate.
Okay, based on what you have mentioned, these school children, we need to know, for example, so what is needed exactly for teachers or at the schools? Is there any awareness that you guys have been planning for, or are the teachers having the knowledge of how to prevent these children from such kind of things?
Yeah, thank you. There was an ongoing program that carried out by Buluk Eye Center in collaboration with Ministry of Health and CBM, our main partner, Christian Blind Mission. We are training school teachers, primary school teachers, on diurnal basis about the eye diseases and how to prevent and how to detect a child with low vision. And they were equipped, even we give them pamphlets with all the diseases. And I believe they're using that knowledge at the right time. So, and those who don't get the training from this platform, I will also encourage them during parade or during class, give to the children these health measures, the preventive measures that they have to observe the hygiene promotion. They have to wash their hands frequently. They should not touch their eyes. They should not share handkerchief or towel. They should not even share eyeglasses or share eye drops, even cosmetics. So those are the simplest. And I believe still we have the sanitizers from time of the corona. Still we have them in our school, in our facilities. We need to clean the furniture with detergents, because this virus is very funny. It can remain on the surface for almost 30 days or more. So by cleaning the surface with detergent and also observing these preventive measures, we'll be able to arrest this epidemic.
Okay.
Yeah.
So then let's come to the point of at times people saying that stress can lead to red eyes. Is that true? And if that is true, then how can I differentiate between that I have stress that led to this one and at the same time this is a red eye disease?
Yeah, as I mentioned from the beginning, that the causes of red eye, there are many.
Yes.
If you have a sleepless night, for sure you wake up early in the morning, eyes red. And also if your blood pressure shoots due to stress, blood pressure shoots, the small muscles of the eye can become red. Yeah, so you can differentiate it, because the stress of the red eye, the red eye of the stress is just red.
Just red.
Just red. Yes, without any pain. Yeah. But the red eye for viral conjunctivitis, there are many, like pain, tearing, swelling, photophobia. Even we go further that your vision reduced. So this is specific for infectious, but for stress, just red eye.
For those now who are listening to you right now or watching you live, what kind of the faster way to secure an eyes infection, for example?
You mean to treat it?
Yes.
Yeah. As I said, from this platform, I hope our viewers will understand that the one he was having or she's having is it infectious red eye. If it's infectious red eye, you at home before going to the hospital, you can just apply cold compresses. Or compresses, it will reduce the inflammatory symptom and sign. And you can take a painkiller. Painkiller is not harmful, at least to reduce the pain until you come to a health facility. But I will say again, don't apply an eye drop without being prescribed.
Okay.
Yeah.
Now, Doctor, as a medical director in the Buluk Eye Centers, since this pandemic happens, I didn't hear, or for more especially like the awareness towards radio or as a jingles to the states or to our communities, is there any plan for that one so that at least maybe this one can transfer to our boomers and diamonds?
Yes. Buluk Hospital, as I said, has been having partners, and we've been playing jingles about other eye diseases.
Yes.
Even through platform SSBC, we've been playing jingle regarding diabetic retinopathy, regarding glaucoma, regarding cataract, regarding harmful effect of smoking. So we have a plan now. We are going to start putting posters,
Yes.
posters with the right eye and the management of it, and also we will be designing or developing jingles, and this time we're going to make it even in our different languages,
Yes.
because not all people can understand Arabic or English. So we'll try to make it at least in our local languages so that this epidemic will come again. Even though this finished, it will come again, because we have first epidemic of this conjunctivitis red eye syndrome in 2007, and we have another again also had another one in 2010, and now we have this is the third one, and which means since our borders are open, we will have it in future. But if our people are equipped with this knowledge, any further emergence of such epidemics, they will be ready and they will be prepared to handle. Yeah.
What can you say to those who are having that panic about this pandemic? But as you see someone having that one, say, oh my God, this thing is now disturbing. Although it's happened, this is now the second time in Cuba, but people take this one seriously, right?
Yes, it's a human nature. Human nature. The eye is very sensitive organs in the body, especially when it turns red. You think I'm going to be blind.
Yeah.
But I'm assuring them from this platform here that red eye disease is manageable.
Yes.
Yeah, the symptom and sign is very difficult to handle. I know it's painful, but with the right measures, as I said, don't panic. You will be okay within a few days when you follow, and don't follow other advices outside medical field.
Yes.
Yeah.
Okay. From this platform, so we are about to come to conclusions to our programs. What are the tips of the day for today you can give us as a specialist?
Tips for the day, and this I used to continue to say it wherever I got opportunity in such platform.
Yeah.
First of all, the eye, once you lose your vision, you can't gain it. So it's a very precious organ. Please don't self-medicate yourself. If there is any eye issues, please contact an eye personnel, not necessarily a specialist,
Yes.
because we have medical who are trained to handle that. And if you happen to get foreign body into your eyes, don't let anyone to say let me remove for you. And also from this platform, I would encourage our population who are having diabetes, please. We have a screening system for diabetes retinopathy in Buluk, and child blindness. You see, some children in school, they are failing. They say maybe they are not understanding. No, they are not able to see. Just with simple refractive error, we can give them glasses, they can regain their vision. So let us follow these measures, and don't. I will repeat again, don't buy medicine onto your end, by your own. There is some eye drop easy to pronounce. Probeta. They like Probeta. Yes, Probeta, and there is steroid in composition of that medication. So with the infection, you put this Probeta into your eyes immediately. The immune, as I mentioned, will be suppressed. You now get worse complication of eye, like ulcers. Even the eye will perforate. So come to eye center so that you will get the right advice and right medication, and you will gain back your vision.
Is there any challenges that you have been facing in your facility?
Yeah, challenges always there. You know, we the eye section in the Ministry of Health, we have issue of consumable and drug supply. We mostly rely on our partners, but I'm urging our politician or government to look into that. An eye department also need to be taken care of. But we also face sometimes complaint of patients come to you, you need to operate the patient, you don't have these drugs, you don't have this one. So sometimes it's challenging, and especially cancers. Now we're seeing a lot of childhood cancers coming to us in Buluk. We have to refer them abroad because we don't have the facility, we don't have the chemotherapy, we don't have the machines. So hopefully, with our system, government, I'm sure they will strengthen eye department, and the eye unit will be equipped to manage all the eye condition in South Sudan, not to be referred abroad. And from this platform also, I want to congratulate the Director of Eye Care Service and Minister of Health, Dr. Albino, and my colleague Professor Kenneth Lado. Now they're all in field. They went to IO somewhere, they're doing surgeries. I'm sure with the epidemic also they will be helping at that side of the country. So I'm grateful for that.
Thank you for that. Can you give us your last message, please, Doctor?
Yes, last message is that Operation in Buluk is free. Is actually quite free and affordable, and no one come to Buluk will be sent back without being seen because of no money. And all the health workers in Buluk are South Sudanese, and they are capable, and they are equipped, they are skillful, and we are happy to be serving our population, especially at this critical time of red eye. Even some countries, some people will fear even to come to hospital. But despite of that, we are still operative. With the limited resources, we are still helping our people.
All right, with that, viewers and listeners of SSBC, we have come to the end of these programs, and please to keep tuned to the rest of our program. I am Emmanuel Duku Philip saying goodbye for now. We'll meet another day. Bye.